Hello, everyone. Dr. Kobler here, your favorite urgent care doctor. In today's video, we're going to discuss what blood pressure is, why is blood pressure important for your health, and what things you can do to manage your blood pressure in your everyday life with and without medications. Let's start the video with a bang, shall we?
Let me do this real quick. I'm gonna go here. I'm gonna go here. I'm gonna go here. My name is Uche.
Uche, how old are you?
I'm 20. Yeah. Real quick.
Ryan, how old are you?
41.
And what do you do? Let's go on over there and see why they ended up popping.
Okay.
All right, your name and age, and when did you end up popping your balloon?
She doesn't know anything about blood pressure. In order for us to understand blood pressure, we need to have a basic understanding of the anatomy and physiology of the circulatory system. The circulatory system is composed of the heart, blood vessels, and of course, the blood. These components of the circulatory system function to transport oxygen and other nutrients throughout the body. The heart can be thought of as a balloon divided into the right and left sides, separated at the middle. This balloon fills with blood at each side and is squeezed by a hand, causing the blood to expel out of the balloon.
My name is Uche.
Uche, how old are you?
Another analogy for the heart is to imagine the heart as a hollow muscle that fills with blood and then constricts to squeeze blood out of it. Deoxygenated blood from the body fills the right side of the heart and is squeezed into the pulmonary artery or the lung circulation in order to be in contact with the oxygen that we breathe in. This allows the blood to become oxygenated. This now oxygenated blood fills the left side of the heart to be squeezed into the aorta or the master artery in order to transport oxygenated blood to the body. The aorta branches into the different arteries throughout the body, which branches into smaller and smaller arterioles that then branch even smaller down to the cellular level to the capillaries. Capillaries are one red blood cell wide in diameter and allow for one red blood cell to pass at a time in order to deliver oxygen and nutrients to the cells of the body. The deoxygenated blood then moves to the small venules, to larger and larger veins, and all the way back to the right side of the heart via the superior vena cava and the inferior vena cava. These are the largest veins in the body. Now that we have a basic understanding of the circulatory system, we can now start talking about blood pressure. Let's start off with a patient case. A 52-year-old female presents to the clinic with questions regarding blood pressure. The patient does not have a past medical history of hypertension and is not currently taking any medications. I walk into the room and see the patient with a stack of pads and paper. She is concerned that her blood pressure has been uncontrolled and is becoming too elevated. She tells me that she has been measuring her blood pressure at least 3 times a day for the past several months after listening to a podcast of a doctor of chiropractic stating that blood pressure greater than 120/80 causes heart disease, blindness, and kidney failure. This has caused her much anxiety. She tells me that she is using a wrist blood pressure cuff to measure her blood pressure at home. I ask her to show me the readings of the blood pressure, and the average blood pressure throughout this time has been ranging between 125/80 to 130/90, with a couple of readings in the 140/80 range. The patient tells me that she is very concerned that her blood pressure is too high since her blood pressure normally is 110/70. Let's pause. In my own medical practice, I have seen this scenario play out time and time again. There are several key points and questions that are unanswered within this case that highlight the concepts that we will be discussing in this video. Questions such as, is blood pressure consistent throughout the day? What causes it to change? How often should you check your blood pressure? Once a day? Once a week? Is 120 over 80 the correct goal? What is normal blood pressure? What is the difference between measuring your blood pressure with a wrist blood pressure cuff versus other blood pressure cuff? What are the consequences of elevated blood pressure? Is blood pressure only controlled with medications and nothing else? All of these questions are going to be answered by the time we reach the resolution of this case. Please be on the lookout for the answers to these questions throughout the video and see if you can actually answer these questions before we get to the resolution. Let's resume with the video. Blood pressure is considered a vital sign, along with heart rate, temperature, respiratory rate, and pulse oxygenation. Vital signs are measurable indicators of the body's most basic physiologic functions. They reflect how well vital organs are working to maintain life, especially the heart, lungs, and circulatory system. Monitoring vital signs is often the first step in any medical evaluation, providing a baseline for health and acting as a early warning system for potential problems in clinical encounters. Blood pressure is defined as the force that blood has exerted against the walls of the arteries by the heart. So, what does this mean in a practical sense? You can think of blood vessels as a flexible pipe. When the heart pumps blood out of the aorta into the arteries, this places a force against the blood vessel wall. In simplest terms, blood pressure is how hard the heart has to pump against the flexible tube in order to allow blood to flow through an artery. Blood pressure is recorded by two numbers. The top number represents the systolic blood pressure, and the bottom number represents the diastolic blood pressure. These two numbers represent the two phases of heart pumping. The first phase is the squeezing or contraction phase, also known as systole, and the second phase is the relaxation or blood filling phase, also known as diastole. So the top number is the amount of pressure that is exerted on the artery walls by the heart when the heart contracts, the systolic blood pressure. And the bottom number is the pressure exerted on the artery walls when the blood is at rest, or the diastolic blood pressure. Both the systolic blood pressure and diastolic blood pressure are important based on the clinical context, but for the purposes of this video, we are going to focus on the top number, or the systolic blood pressure, from this point forward. So, how exactly do we measure blood pressure? We measure blood pressure with a non invasive device called a sphygmomanometer. Yes, that's the word, sphygmomanometer. It is 31 points on Scrabble, just in case anybody was wondering. The sphygmomanometer, or blood pressure cuff, is composed of a cuff that is connected to a pressure gauge. This cuff fills with air, and this tightens around the extremity that is in the cuff. This causes the blood flow to temporarily be blocked in that extremity. As the blood pressure cuff loosens, the device measures the minimum and maximum pressure that is exerted by the artery. The most accurate way to measure blood pressure is by using a blood pressure cuff located at the upper arm above the elbow. This measures the blood pressure of the brachial artery. Wrist blood pressure cuffs measure the blood pressure at the radial artery and are less accurate than upper arm or brachial artery measurements. Therefore, I do not recommend any of my patients to use a wrist blood pressure cuff. According to the American Heart Association / American Medical Association Joint Policy Statement of 2020, how often blood pressure should be measured at home depends on why the blood pressure is being monitored in the first place. If your doctor would like to try to diagnose if you have a blood pressure problem, or your doctor has prescribed you medication to adjust your blood pressure, then you should check your blood pressure with two readings, 1 minute apart, twice per day for at least 3 to 7 consecutive days. and take the average of all recorded values. If your blood pressure has been controlled and stable for several months, then ideally you should check your blood pressure with 2 readings 1 minute apart twice per day for 1 to 3 days per week. Research has shown that taking 2 blood pressure readings twice per day for 3 days per week provided a reliable out of office blood pressure estimation. So now that we know how often to check our blood pressure at home, what is the ideal blood pressure value that we want to achieve? The answer is it really depends on your specific circumstance. In general, your ideal blood pressure is based on many factors, including your age, if you have underlying heart disease, if you have underlying kidney disease, if you have type 2 diabetes, and genetic predispositions. Here is a chart from the American Academy of Family Physicians from 2023 that compares specific blood pressure treatment goals in specific patient populations based on different major medical organization guidelines. So, as you can see, even among major medical organizations, there is variability in the blood pressure goal. The nuances, if needed to be considered, will be discussed by your doctor as you are their individual patient. The days of the blood pressure target being 120 over 80 is no more. There is more nuance to blood pressure than a one size fits all. Now, in order to determine what the urgency is in seeing your doctor, that will be based on the average number recorded. 2 good rules of thumb for the average patient would be 1, the top number is the most important, and 2, extremes are bad. Too low, bad, or too high, bad. Let's break this down further. If the top number of the blood pressure recording is greater than or equal to 160 consistently, meaning multiple readings that are spaced out in a given day and then averaged, then you should see your primary care doctor, go to an urgent care, or go to the ER right away. This is a dangerously high blood pressure. Now, if the top number is less than or equal to 90 consistently, meaning multiple blood pressure readings that are spaced out on a given day and then averaged, this means that you should see your primary care doctor, urgent care doctor, or ER doctor right away. This is a dangerously low blood pressure. So, the general range for the top number that should prompt you to seek medical attention urgently is greater than or equal to 160 or less than or equal to 90. In general, if you are within this range, then medical attention is not warranted right away, and you can wait to see your primary care doctor. Whenever you're in doubt, you can always see your primary care doctor, go to an urgent care, or go to an ER. You can never be seen by a doctor too many times, especially if you're concerned about your health. I always encourage you to speak to your doctor first for taking any actions or decisions related to your health. You can see that there is a lot of flexibility in the blood pressure ranges. This reflects the fact that blood pressure will change throughout the day and is not a fixed number. Blood pressure is not a fixed number, and nor is it supposed to be a fixed number. The average number is what's the most important thing, not one outlier reading. Now let's talk about high blood pressure and low blood pressure. Again, I need to emphasize that this depends on your specific patient characteristics, age, and your underlying medical conditions. Let's start with high blood pressure first. High blood pressure, also called hypertension, can be divided into primary hypertension and secondary hypertension. Primary hypertension, also called essential hypertension, is the genetic predisposition to develop high blood pressure. It is multifactorial in nature, and there is no one identifiable cause for this type of hypertension. This diagnosis can only be made if secondary hypertension has been excluded. Secondary hypertension is when high blood pressure develops by something that we can point to that can explain why their blood pressure is elevated at that particular time. There are several causes of high blood pressure in general, and they can be divided into modifiable causes and non modifiable causes. Modifiable causes include alcohol use, high sodium intake, drug induced or substance induced hypertension, obesity, sedentary lifestyle, and stress. Speaking about drug induced or substance induced hypertension, there are common medications that cause elevated blood pressure, including NSAIDs such as ibuprofen, naproxen, etc., oral contraceptives, decongestants such as Sudafed, Afrin, and similar products, antidepressants, corticosteroids, stimulants such as caffeine from coffee, energy drinks, soda, ADHD medications, and illegal drugs such as cocaine and methamphetamine. Non modifiable risk factors for hypertension include obstructive sleep apnea, kidney disorders, thyroid disease such as hypothyroidism and hyperthyroidism, adrenal disorders, and coarctation of the aorta. So, what are the long term consequences of having an elevated blood pressure? They include kidney disease, which leads to chronic kidney disease and end stage renal disease, heart disease, such as congestive heart failure and myocardial infarction, and stroke. So, how exactly is high blood pressure treated? High blood pressure is treated by lifestyle modification and medications. So let's start with lifestyle modifications. A lot of people talk about lifestyle modifications, but what does this exactly mean? Lifestyle modifications are when you take responsibility for your own life and choices and make adjustments in your everyday life that target the specific reason why your blood pressure is elevated. So, for example, if you drink 2 to 3 beers per night every single night, that definitely can cause your blood pressure to be elevated. So, a lifestyle modification would be to reduce the amount of alcohol that you drink per night, with the hope that your blood pressure will go down. Some general lifestyle modifications that help to decrease blood pressure include increasing your daily cardiovascular exercise. This could be as simple as walking 15 minutes per day, or riding your bike, or swimming. Any activity that gets you moving and increases your heart rate will definitely help to reduce your blood pressure. Other lifestyle modifications include decreasing alcohol consumption, quitting smoking, and diet modification. Speaking of quitting smoking, one of the next videos that I will be making will discuss in detail how to quit smoking. So please be on the lookout for that. Anyway, back to the lecture. So, one of the more targeted diet modifications to help to decrease blood pressure is by decreasing the sodium intake in your diet. Sodium is a salt or sodium chloride. If you look at the back of the food label, you will see an area where it says sodium, how much grams of sodium are in the particular food product by serving size. The easiest way to achieve a low sodium diet is by following the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. I have linked the DASH diet website in the description of this video. In a nutshell, the DASH diet emphasizes consuming a lot of fruits and vegetables, whole grains, low fat dairy, healthy fats, and lean protein, while avoiding high sodium foods such as cold cuts, canned soups, snack foods, and fast foods. These simple changes that I just discussed will not only help to control your blood pressure, but will make you feel better without having to take medications. I have to emphasize this point because there's been a lot of discussion in the media that doctors are only trained to prescribe medicines. That is completely not true. I am a doctor and I have been trained in prevention and lifestyle modification. But medications are there for a reason because they do help with controlling blood pressure. So, the other way that we help to decrease blood pressure is by using medications. If lifestyle modifications have truly been tried and they're still not having their blood pressure controlled, then your doctor will prescribe you a medication that will help to lower your blood pressure to get to the target range that you need. A doctor will usually start off by prescribing a combination medication, i.e., two medicines in one at the lowest dose. During this time, your doctor will ask you to measure your blood pressure at home, as discussed before. Based on those values, will determine if any adjustments to the medication is needed or if any different medication needs to be tried. Now let's talk about low blood pressure or hypotension. Low blood pressure or hypotension has to do more with the lower blood pressure causing symptoms such as dizziness, loss of consciousness, etc. I'm not talking about life threatening hypotension, which needs to be treated in the ER. When it comes to the causes of low blood pressure, they can be thought of again as in modifiable risk factors and non modifiable risk factors. Modifiable risk factors of low blood pressure include drug or substance induced causes, such as blood pressure medications, nitrates, erectile dysfunction medications such as Viagra, antidepressants, antipsychotics, opioids, sedatives, and alcohol. Other modifiable risk factors include dehydration and volume depletion. This means decreased intake of fluids, vomiting, diarrhea, excessive diuresis, excessive burns, hemorrhage or blood loss, and sepsis. Non modifiable risk factors for low blood pressure include hypothyroidism, adrenal disorders, heart related conditions, and neurologic conditions. Low blood pressure is treated by first understanding the underlying cause of the low blood pressure and then treating that. Then we can get into lifestyle modifications, such as increasing fluid intake, small frequent meals, and exercise that focuses on strengthening the lower body. There are also medications that help to reverse low blood pressure, but it really depends on what is causing the hypotension. The long term consequences of low blood pressure include heart disease, kidney disease, cognitive decline, falls or injury, and chronic fatigue. As this video draws to a close, I'm going to summarize what we've learned with the resolution of the patient case from the beginning of the video. Remember, this was the 52-year-old woman who was concerned about her blood pressure. I first tell her that I am proud of her for being proactive about her health and explain to her that blood pressure is the force exerted on the walls of the artery by the heart. I assure her that while elevated blood pressure could lead to heart disease, kidney problems, and stroke, that in her particular case, her average blood pressure that she measured over the past couple of months is at the appropriate target range for her given age and risk factors. I tell her that as long as her average blood pressure is within the range of less than 130/90, then her risk of cardiovascular conditions, kidney problems, and stroke will be significantly reduced. I tell her that she can maintain this target blood pressure with different lifestyle modifications, such as daily cardiovascular exercise, reducing processed food and alcohol intake, and by increasing the amount of fresh fruit and vegetables in her diet. I also emphasize the importance of sodium reduction in the diet as well by showing her the DASH diet website. I tell her that she does not require blood pressure medication at this time, and therefore I advise that she decrease the number of blood pressure measurements to twice per day, 1 to 3 times per week. I stress that if she is at home and she finds that the top number is less than or equal to 90 or greater than or equal to 160 for multiple readings, that she should see me right away or go to the emergency room or urgent care in order to control the blood pressure. I advise her to purchase a upper arm blood pressure machine because wrist blood pressure machines are not accurate. I stress the importance of being careful about consuming health information that's posted on the internet, and that she should only obtain information from appropriate evidence-based medicine resources, such as the American Heart Association and others. And I stress to her that she should see me before making any decisions about her health, because I am here for her and I want to help her as best I can. So that's the end of the blood pressure video. I hope you now have a healthy understanding of what blood pressure is and why it's so important for your health. Please like, subscribe, and share this video with anybody who's being treated for blood pressure. Your family, your friends, anybody who's curious about blood pressure, please share this video with them. I'm sure that they will find it helpful and it will answer a lot of questions that they have. And remember, the more people know how to take control of their health, the better off we all will be. Thank you for watching, and I will see you in the next video.